39 states are seeing a rise in COVID cases, including the states that surround us. But so far, Ohio remains stable, although we are seeing a slight uptick in cases.
Yeah, for what we need to know about it, let's bring in senior health correspondent Monica Robbins to explain.
Well, if those allergies are still bothering you and you're feeling exhausted and fatigued, you might want to take a COVID test because it might not be allergies. The latest COVID symptoms seem to mimic respiratory illnesses, and while they may be mild, they can include sore throat, congestion, nausea, fatigue, diarrhea, loss of smell, fever, chills, cough, and body aches. These are the typical things we usually don't experience during summer. Now, it's still not a seasonal virus, so we can't predict when we're going to have a peak season, and we've learned in the past that it is not uncommon to see summer spikes. As of last week, our wastewater monitoring indicates the JN1 variant is the main variant infecting Ohioans, and last week we had 84 new hospitalizations and cases top 1,700 reported. But as we know, that's just a drop in the bucket because as what's probably really going on since we don't test like we used to. We also had 9 deaths last week. Meanwhile, even though it's summer, remember, COVID never really went away. And with the July 4th holiday weekend, it's a perfect time for the virus to spread at parties among crowds. So wash your hands, use care around those who are more vulnerable. And keep in mind, the CDC vaccine advisors on Thursday will discuss who should be getting the updated COVID-19 shots that will be released in the fall. But likely, you can imagine, those over 65 and the immunocompromised will be at the top of the list. Guys, back to you.
All right. Good information. Monica, thanks.
Sure.